Hello, this video is going to be reviewing the Level 1 Rapid Infuser. First thing that you should do is ensure that it's plugged into an outlet, as this device does not have any kind of backup battery. So we have our tubing here. This is the box that it comes in. You're going to open this up, and we want to prime this with our normal saline. There are two spikes in the top. One will be for our blood product and one will be for our saline, our plain IV fluids. So products that you can put through here is your plain IV fluids, packed red blood cells, and FFP. You should not be putting platelets, cryo, or granulocytes through the machine. When you are spiking your saline bag, you want to de-air the bag. So you can take your spike out of the top, spike the bag, unspike it, and squeeze your air out, eliminating any of the air bubbles, and then re-spike it here. Okay. And you can go ahead and hang this in one of the chambers. You can use the top rung here. Okay. Then we'll go ahead and continue priming our tubing, making sure we get all of the air out. You're going to open up all of your clamps. And go ahead and prime your tubing. Alright, so now we have that on. We'll put our tubing into our machine. So it has numbers to help guide you, number 1, 2, 3, and 4. So we'll start by putting this into number 1. You're going to press it down in there, push this back, and then pull number 2 down. Number 3 here, you can pull this tab to open that door up. And you're going to line this up so your tubing will go in that slit. Push this back into the number 4, and then we'll go ahead and close the door. This goes up and then down and in. So now we have our tubing loaded into the machine. We want to ensure this chamber is filled with our solution. It's a 3% hydrogen peroxide solution, but if you don't have that, you can use distilled water. You never want to use tap water. That can actually interfere with the electrical current of the machine. To turn the device on is the green button here. So this will heat up to 41 degrees Celsius. We can close our chamber for our normal saline bag. You do that by putting this black latch on the side of the door. Then if you're hanging blood products on the other side, you can go ahead and spike your blood products. And your blood products already come up de-aired from blood bank. And now we can actually put this on a lower rung out of our machine to ensure it doesn't clamp off our tubing once we close the door. And we'll also close this with that black latch. And now to pressurize these bags to 300 millimeters of mercury, we'll turn this to the positive. And once it's pressurized and heats up to 41 degrees Celsius, you can go ahead and infuse into your patient. They should have an 18 gauge or larger peripheral IV if you're using peripheral, or you can infuse through a central line. And then your tubing would be good for 3 hours. Once you're done using the device, you turn the orange button here to turn the machine off.